Hello, everybody. Thank you for joining us here today. My name is Fabiana Bacchini. I'm the Executive Director of the Canadian Premature Babies Foundation. And since the beginning of this pandemic, I've been doing Facebook Lives twice a week, Mondays and Fridays, 1 p.m. Eastern Time. And I'm bringing specialists, researchers, parents, and healthcare professionals in general to talk about what is happening right now in the NICUs. How can we continue to go to follow-up appointments with your baby after discharge? We also talk about the latest research related to COVID or not. So there's a variety of topics, and you can access all the previous sessions on our website, which is canadianpremis.org. And this week is self-care week, and you're going to talk about self-care. This is something that parents, especially moms, don't do enough. And to talk about that, I brought here today Leanne Rose Dorish, who is a proud mama of a 2014 NICU graduate, and she has her master's degree in clinical counseling. As a registered clinical counselor, she recognized the trauma that her son's NICU stay created within herself. So Leanne has turned her 11 years of trauma work experience into building community and resource for NICU graduate families and the organizations that support them. Leanne is an author, speaker, and a guest blogger on the topic. Leanne, thank you so much for joining us here today.
Oh, thank you, Fabiana. I'm honored. It's exciting to be here.
Thank you. So Leanne, you took your own experience in the NICU to help other NICU families heal from trauma. I would like you to share a little bit of your story with us and the story that has led to the work that you've been doing now.
Yes, thank you. So I was 30 weeks pregnant, and we were at a friend's for dinner. And funny thing is that it was a big deal because for the first 4.5 months of my pregnancy, I was just throwing up night and day. And my husband was making me like eggs and cutting up cucumber, and I was eating watermelon, some of the only things that I could eat. And we were having such a good time that we decided to spend the night at that friend's house. As I was getting ready for bed, I realized I was bleeding. So my husband rushed me to the nearest hospital, and there things started happening really fast. We got upstairs, and I heard one of the nurses at one point say, "We can't find the baby's heartbeat," and another person said, "Well, she's losing too much blood." And at one point the OB said, "They're not dying on my watch." And you're already sort of out of it. And they rushed me to the OR, and I heard 2 little whimpers. They took my baby away. They transferred us to the best NICU in the area. We had about a day or 2 there, and then the doctors took us into a room and said, your baby's had a massive brain bleed. He's going to have to go on the neurosurgery list, and he won't walk and he won't talk. So every day we were back and forth to the NICU, and Sky's health was up and down and up and down. One day we walked in, my husband and I, and the room had about 10 incubators in it, and some were that blue jaundice light. Others were just like regular room light, and Sky's incubator was glowing green. And there were these 3 beautiful figures around his incubator, the biggest and the brightest at the head of his bed. It felt like they were there forever, but when my husband nudged me and asked if I was okay, I kind of like shook, and they were gone. So after that, Sky's health still going up and down. And then the neurosurgeon came to us after a while and said, I've heard of this happening, but I've never seen it in my career yet. But Sky's healing himself. We're going to pause neurosurgery, not take him in, and we're just going to watch him. Okay, as parents sitting in the NICU, you don't really know what to say to that. So he was watched, monitored over the few weeks, and days kept going by. It was 60 days. And the doctors came to us and said, "You can take your baby home." Obviously, we were overjoyed and kind of freaked out at the same time. So we transitioned home as best as we could. And one day I was sitting on the couch. My husband had to go back to work full time. My mom was gone, and the friends, that were supporting me weren't there at the time. And I was feeding Sky, and I looked down at him, and the dishes were piling up, and the laundry, and the doctor's appointments, they were just one right after the other, and they felt like they were piling up. And I look at Sky and I think, how is it that I brought such a beautiful being into this world and we survived through so much? Why do I feel like this? Why should any parent feel like this? And honestly, it was in that moment that I thought, if I have anything to do with it, no parent is going to feel like this. And so I kind of put ideas together, and now I have, the online community of my NICU family. And, through a lot of my research and exploration, you remember those figures that I saw in the NICU that day? I now believe that it was an archangel named Raphael and two of his helpers. He's considered the healer or the doctor of the archangel community, if you will, and his aura glows green. So I thank him every day, because my Sky is now 5.5, and he talks like a teenager, and he walks like his own little champion. So that's where I've come from.
Oh, that's beautiful. And thanks so much for sharing your story. And I always believe in the power of sharing stories. When you become so vulnerable, there's so much strength in that, but there's so many other families that we also help with our own stories. But tell us a little bit about My NICU Family, because it's a community resource. What do you offer for families?
Yeah. Well, I'm really happy to be on a few different things. I have my website, which is where people can find everything that I do. I've got my About page, but I also have links to my social media. I'm on Instagram, Facebook, LinkedIn for more of the organizations that support NICU families, and YouTube. I've got a channel. And it's all under the My NICU Family name. And on there, I have live Wednesday chats in the morning Pacific time, where lately I've been talking a lot about post-traumatic stress and trauma, but anything can come up. And then on Saturdays, I do a series. It's a pre-recorded series, but I launch them on Saturdays. It's called Walk With Me. And a lot of the time I'm brainstorming, and I have people comment in, and we just have conversations that way. I also have, I'm a clinical counselor, so I have ways that people can have one-on-one sessions through Zoom or on the phone. I support couples as well, and small groups. So if a family unit is having a hard time, maybe they need someone to understand more of the NICU perspective, or, empathetic care kind of stuff. And then I do workshops for organizations. So.
Leanne, but how you shared with me before that you suffer from PTSD after the NICU, and you, as a trauma counselor in your previous life from the NICU, how did you incorporate all that into your work? Because I think there's a lot of people who, sometimes you struggle with PTSD. We don't know what it is, but you experience, and now based on your own journey, you're helping families to deal with that. I wanted to talk a little bit about that, but also, when can a family differentiate the regular stresses of having an ICU baby to realize, I am having these symptoms, I'm experiencing these feelings that I don't think I should be feeling. So how do you differentiate, and how do you need to go for help with those things?
Mm-hmm. Those are really good questions. And the first thing I want to say to that is that every experience is personal, every way that you take care of yourself is personal, and trauma is also a personal experience. You know, there are statistics out there saying that 2 in 10 people that experience the same event will come out with post-traumatic stress disorder. Well, in the NICU, I feel like parents especially, that number is probably higher, more like 5 or 6 out of 10. It might not be a full diagnosis, but you'll definitely have symptoms. So the way I've incorporated like my trauma work into the work I do with my families is it's about education, you know, learning what post-traumatic stress looks like you said, versus regular stress. And one of the main things I say is, do you feel like you can control it, or do you feel like your flashbacks are taking over? And so regular stress has the element of overwhelm, and there's still that capacity to have control. And control, that word is kind of loaded because it was one thing I had to unpack for myself on my journey. I liked having control, and having a NICU baby, you have to let a lot of that go. But then with post-traumatic stress, the fact that the memories or of an event or a situation, or even just a glimmer of time during your NICU stay, if that keeps coming back to you, you know, you have that memory often enough, you can't seem to like get rid of it. It's called a flashback, and it can impede a lot of your daily life. You know, it can create a lot of anxiety, and it can take over, right? So being aware of that spectrum, and you don't have to be on the full disorder side of it, but having the symptoms of post-traumatic stress can be there.
So when is it time to look for help? When you how long do you wait to say, okay, maybe this is gonna pass, this is temporary? So do we wait? Do you look for an immediate intervention? So it's hard sometimes to identify those things, right? And you think, okay, this is gonna go. Does it?
Right. So it depends on who you are. Like I said earlier, it's sort of like a personal thing. But the moment that you feel it's not serving you, whatever it is that's happening, the emotional roller coaster, the sleeplessness, the hopelessness, the pulling away from friends, you know, just wanting to avoid a lot of stuff. As soon as those things don't feel like they fit in your life anymore, whether you notice them or a partner notices them and says, you know, do you want to go and talk to somebody about this? That's sort of your indicator. You know, for me, like I couldn't be my own counselor as much as I might have wanted to. I knew I was going through some shock, but I was awake in the middle of the night and I had tears streaming down my face. And I came out of like a full-on, full-body flashback of a really tough time with Sky in the NICU. And it was in that moment that I realized I had post-traumatic stress. And I probably had the full disorder at that time because I was really withdrawn, avoiding. I couldn't see what was going to happen in the future for us. Lots of anxiety and depression. And it can happen up to a year after you have a baby, right? So all of these like perinatal mood disorders are being researched more now, and it's I think it's because we're talking about it more. So.
Absolutely, and it's something that we have to continue the conversation because there's still a lot of stigma around mental health, and I think mothers have this guilt inside. Oh, if I cannot feel this way, I have to feel that way. And we know for fathers in the NICU, there is a higher risk of PTSD, that we have to keep this conversation going. And there is no shame in ask for help whatsoever.
Yeah, I like hearing that, because in the mental health field, you do get a lot of sort of pushback.
Absolutely. And it is self-care week. Let's talk about self-care. This is such a difficult concept for mothers and caregivers and partners. What is self-care that we talk about? Why is this so important, especially for caregivers? I talk about moms, but I mean every parent looking after children, or any caregiver look after babies and children after the NICU.
Mm-hmm. Well, for me, it's important to identify what each person or what I feel rejuvenates me on a daily basis. Now, a lot of us probably think of going and getting our nails done or doing yoga or having a bath. Those things take time, and it takes us away from home. And right now, you know, the spas probably aren't open or places that we want to go, right? So for me, self-care are those little glimmers of time, seconds, like seconds during your day that you can connect with one goal, if you will. And this is kind of how I work it with my people, that can ground you, recharge you for just that moment. And then it helps you keep going.
Wow. Yes, it is such an important thing to identify what it is for you. Because
Yeah.
for many years, you know, I was also in 5 months in the NICU. I brought my son home on oxygen, like a very complex care needs. And people say to me, I just go to do a manicure and pedicure. Okay, for me, this is not self-care. This is not, I'm not pampering myself by doing manicure and pedicure, because I'm from Brazil, and in Brazil, doing manicure and pedicure is part of your grooming. So for me, it's not a real treat. So
Right.
I think it's for us to be really aware and what it is for us, what is going to make us replenish, what are those seconds. And you share with me something that I truly believe on, the power of gratitude, like how that helps you, how you put gratitude into self-care.
Mm-hmm. Yeah, for me, it has been an essential service for myself, because being a NICU mom and a trauma counselor, I've noticed that my sky can be a trigger. And I don't think anyone wants their own child to be a trigger for them. And so unpacking that and figuring out how, in those moments of like roller coaster emotions, especially around his birthday, I can take those 5 seconds at the kitchen sink, feel my feet on the floor, push my shoulders down, and take a breath in. And for me, closing my eyes is just making it that much deeper in my body. And I've practiced that so much that as soon as I get to the kitchen sink, I close my eyes. And the other day, my husband's like, "Are you okay?" I'm like, "Yep, just self-care." He's catching on, but you know, like he's like, "Okay, just making sure you're not crying or anything," you know. So, but it's really powerful, you know. And I try to encourage 5 seconds 5 times a day and build on that, because we don't have 5 minutes sometimes. That's a long time when you have a NICU babe, but also like other children or things that you have to do. And I actually put a lot of the little tips and tools into one of my books. It's called
That was my next question to you. Like you put all in a package in a book. So, and you just launched, congratulations. So tell us about your book.
Yeah.
Where this idea came from to put all together.
Thank you. So I wanted to share. I wanted more people to know that they can take care of themselves even if they don't have 5 minutes. And I was watching, you know, all sorts of people in my life struggling, trying to take care, have a moment for themselves. And because we both know that going in the bathroom and locking the door doesn't always work. That's not peaceful. So I put this book together, and it's really easy little chapters. Very fast read. You don't have to do cover to cover even. It's self-care from A to Z after a NICU stay. And I've had many people read it who aren't involved with a NICU or parents of, and they say they are getting a lot out of it. It's just the fact of taking seconds, you know, being your own, and especially now with COVID and being isolated and not doing those things like maybe having a mom's group or going for a walk, we have to think differently. And so having as many ideas as we can so that we can connect with just the ones that work for us and give us that rejuvenation, that's kind of where it came out of.
Wow, that's wonderful. And thank you so much. If people are interested in finding your book, is it available in bookstores, online?
Yeah, so right now it's online. You can go to my website, which is mynicufamily.com. There are links there. It takes you to Amazon. So there's it's throughout Amazon's marketplaces. We've got, I think I have some reviews on Goodreads too, so that's nice. And I am working on getting it into a platform so that bookstores can sell it. So
Leanne, thank you so much for your time today, for sharing your knowledge, your experience with us.
Thank you so much, Fabiana.
So thank you everyone for watching us here today. On Wednesdays, every Wednesday, Kate Robson, who is a psychotherapist and also a mother to preemie girls, is hosting a real-time peer support group. To access her group, you can join the Canadian Preemie Parent Support Network, which is our private Facebook group for NICU parents only. Thank you so much for watching us. All the previous Facebook Live have been recorded and are available on our website. If you are interested in different topics, you can log into canadianpremies.org. Stay well, and I see you next time.
Thank you.